Hey, good morning. So glad you joined us again here on HealthCall Live. This is going to be an important half hour of local health radio. Regular listeners to this show and on my Tuesday morning HealthCall updates we do with Kayla Blakely are not surprised really by anything you've heard this week about the COVID-19 virus. We've been tracking this virus extremely closely since January, and I've been telling you what to expect, what's coming, and all the changes in daily life that are likely. Well, now they're here because the virus is here. And I know many people still have lots of questions, and that's why we have Allen County Health Commissioner Dr. Deborah McMahan with us on the phone until 9:30 this morning. We're opening the phone so she can take your questions. Something you need to know, here's an opportunity to ask our local experts. So let's welcome Deborah McMahan to the Health Call Expert Line. Good morning, Deb.
Good morning.
You sound so happy to be here.
I'm just happy to be alive and happy that I live in Allen County because, man, I tell you, there's a lot of good people here working round the clock like you. You've been in a lot of these meetings, too. I'm just happy to be in Allen County.
You know, it is, I will say, as an outsider, I'm not a clinician, I'm just an observer here, but I have been very impressed with how your department has come together with so many segments of the community and really put together a plan and a preparation, a scheme for this county to follow. I think we may be ahead of a lot of other areas because of that. So congratulations to you. Let's talk now about the announcement yesterday that schools are going to be closed. I think we all know that information. The other big question, the other area where this virus can spread a lot is through daycare centers. What are we going to do about them?
I think we were trying to get through yesterday in terms of, again, and I want to preface this with what I've been saying at every meeting, but maybe people haven't heard me yet, so that all your listeners were all on the same page. So if I could take 1 minute to say that we are in uncharted territory. We have never in our lifetimes had a pandemic with a non-influenza agent. And why does that make it different? Well, number one, the mortality rate with this particular virus is 23 times higher than H1N1. Number two, we have no readily available treatment, and we have no readily available vaccine. So for those reasons, we can't treat this like just any other type of outbreak, epidemic, or even pandemic. So that's why we're having to move so quickly, because our goal is to keep healthcare up and running, not only to treat people who are sick with respiratory, but to treat heart attacks, strokes, car accidents, all that. To do that, early intervention with social distancing measures is the only way to stagger the pace as this virus, because nobody here in Fort Wayne, or if they do, very few, have any immunity to this. So this will blow through here. If everyone gets sick at once, we're in trouble. So we're trying to pace that through all of these measures, like school closing, like working from home, those sorts of things. So
yeah, I've been trying to explain to people that at its core, this is not only a health problem, this is a math problem.
It's definitely a math problem.
So if 20% of the people who have this condition require hospitalization and 5% of those people go on to require intensive care, we simply don't have the beds in the hospitals to handle all of this.
We don't, and part of that, you're thinking about, well, you don't have the beds, but the other thing that people don't realize is if everybody gets sick at once, that's your healthcare workers too. So you don't have beds, you don't have workers. So when you have your heart attack, you don't get to go in, get treated, get blasted, then maybe have to go to the cath lab, maybe go to the OR. That doesn't happen. So that's what I don't think people understand. It's not like we're trying to gear up just to treat all these extra sick people with COVID. What we want to do is maintain the infrastructure to take care of the everyday stuff for which they are at near capacity every single day. And if 10% of their workforce gets the flu, then you and I don't get treatment. They're going to do the best they can. We have a very committed, but you can you're limited. You can only do what you have healthcare workers and equipment to do, right?
Exactly.
So that's why it's so important. It's not about you. It's about the numbers. It's about the math. It's about staggering infections. We want waves of infection. We're not going to prevent it from coming here. Don't misunderstand me. But we want to do it in a pace. We want to control the pace.
You said something at one of the meetings that caught my ear, and that is you actually explored converting the Coliseum to an overflow hospital. That really, I think, tells people about the scope and scale of this that everybody's worried could be coming.
Well, and that's the problem. The issue that we had, and boy, we did a beautiful drill. We had it all. This was for H1N1 in preparation for that. And then we realized we have no oxygen.
One moment.
These people, if a pandemic, it's always respiratory, and they need oxygen. So we are looking at other mass places, actually, where we may have to take people. And it may be the people that maybe have the respiratory infection. It may be the people that are recovering from the heart attack. We don't know who would go where, how we would actually, allocate those extra spaces. But no, that's called surge capacity, and we've been looking at that. Actually, surge capacity is an important issue that even the trauma folks have been exploring for the past year. What if we had a mass shooting? People don't understand. It takes 5 critically ill people to overwhelm a system. It doesn't take 500. It takes 5. It takes 10. And I don't think people, and that's why it's so helpful to get this, because context is everything. And the average person has no reason to know all of this stuff. But now they need to know that we're in a situation to understand what may seem like draconian measures. I want them to understand the context. You don't have an endless supply. The federal government is not shipping in healthcare workers to help Parkview and Lutheran and Fort Wayne Med Ed. We're not getting any supplies. We've not gotten one supply. We're on our own. And we're on our own with a very serious virus that, if we don't keep healthcare going, could, for a myriad of reasons, jeopardize the overall well-being of our community.
And we're kind of in a situation where our hospitals take the worst of the outlying counties, and they're usually treated here. So if you are, what about Kosciuszko and DeKalb and Wells County? How are they going to be able to manage all of this?
Lee, I don't know. I'm only responsible here, but you do raise a good point. I'm glad you said that, because some of these outlying hospitals don't even have an ICU. So, and they're sending their people to Parkview and Lutheran as well. Mm-hmm. And again, right now we're talking about COVID, but if there is a mass shooting, if there's a mass casualty, a big, 2 or 3 people in a car accident in one of these surrounding counties, those traumas go here. They don't stay there. Those mass traumas go here. And that doesn't stop until COVID resolves. That's all happening even now. So you're right. So not only do they have the responsibility of treating everybody in Allen County, but then, oh, by the way, add the sickest of the sick in outlying counties. So you see why I'm not overstating when I say we need to do everything we can to keep healthcare up and running.
And so let's jump out to the phones. First up is Pat. Pat, what's your question for Dr. Deborah McMahan?
I've always been curious, since you mentioned it the first time, how effective is Risdenafir, I think it is.
Okay, you're talking about a drug made by Gilead. It's called Risdenafir, and it is under clinical trial in China right now. It was a drug that was created for the Ebola virus, but didn't really work out well there. However, now they're testing it in China. Dr. McMahan, do we know any more about how that's going?
I think that they're looking into that as off-label use, because they think it might, but of course they don't know what impact this will have. But that is being looked at as being used off-label for COVID-19.
So the answer to your question is, Pat, we don't really know. There are some other studies that are taking a look at chloroquine to see if that's an old malarial drug, to see if that has any impact. So lots of people are looking at a lot of different things. And
they're actually using them off-label because we don't have any treatment. But even those drugs that you're talking about are very, very limited. So even using experimental drugs off-label for people who are getting sick, those drugs are in extremely, extremely short supply. Again, that's what makes it so serious and why we need to slow transmission.
You mentioned that supplies of the personal protective equipment are very tight. So what's your focus here as we roll ahead the next week? Let's just look short term. What's your critical focus?
Well, my critical focus today is to keep healthcare up and running. I need them to be able to have the equipment they need so their people will come to work, and it's not me, it's all of us. You can't believe how many of us are working together from each institution, so I don't want to say I. But my goal is to keep them up and running and to do whatever we can to give them the supplies they need to keep their healthcare workers and their patients safe. We are running out of things, so you may go into the hospital and things may look different in terms of what you're asked to do, in terms of covering a cough, wearing a mask. I've been trying to tell you that things look different. We have to accomplish the same goal, but things may look different. Just say, and keep going, okay? We have to keep our healthcare workers coming in. Don't be complaining. Please don't get mad because you have to wait. Please don't be short with people now, because what we know from SARS is that they don't come into work then. And then they leave the profession. And you know what? You may survive just fine in the next 6 months, but if you have a heart attack next year and there's not a doctor to open your artery, that's unfortunate for you. So let's have a good attitude, understand things are going to look different. We're going to have to wait a little bit, but our number one goal is keeping the supplies coming to our healthcare workers.
You know, that's a good point. If I'm a critical care nurse and I'm overwhelmed for weeks on end caring for patients, think about that. I'm working a 12-hour shift. I may be in PPE that whole time. There's no end in sight. That's a stressful job.
And that's not just a theory. That was what they found after SARS. A lot of good research on the impact, because that was really the first time I think healthcare workers really realized, oh my gosh, I'm on the front lines. I could get it, and worse, take it home to my family. That was the first time they realized that. And on top of that, they were doing just as you said, and then on top of that, everybody was beating them up and getting, complaining and everything. And the research shows that 40% of them left the profession.
Wow.
So we can't have that, because we already have a shortage of nurses every day of the week.
I have knowledge that layoffs have already begun in the food service industry as events are canceling. And so we're going to have an economic impact, not only businesses canceling events and sending workers home to telecommute as best they can. How are we going to know when it's the right time to relieve those cancellations and send people back into the office? What's that metric?
I started off last week thinking I don't want to do anything without knowing when we will lift it. And I can tell you right now, I can't say that right now. And I, as a physician, I don't think I've ever found myself in that position. But again, I'm dealing with a non-influenza pandemic. Those will be looked at very carefully every day as the scene evolves. There are so many moving parts to this that I think these are decisions that we need to make thoughtfully, but know that everybody's looking at that. I just can't say specifically right now. I could say 2 incubation periods, but in my mind, if we can get through that sooner, then that's what we'll do. We'll do it when it's safe and when we can establish some real criteria with this virus in this community, with this wave of transmission, some clear criteria for which we can say, okay, now we can start pulling back.
So if I have the symptoms, and again, those are a temperature of 100.4 degrees and a persistent dry cough are the 2 primary symptoms. If I have those 2 things, should I just assume that I have this virus and stay home, or should I go get tested?
Well, that's a good question. First of all, there's very limited testing. Testing as of right now, and that may open up more next week, but I can tell you for this weekend, testing through ISTH is limited to people who are sick in the hospital. So if you have a cough and a fever, if you otherwise feel okay, which most people with any type of coronavirus, including COVID-19, will feel okay, I'd kind of rather you maybe stay home. Well, no, I would prefer you stay home until your fever's gone for sure, but maybe a couple days after your fever's gone, okay? Stay home, lay low, maybe have the whole family stay home and make it a movie weekend and a Monopoly weekend and all those sorts of things. So have the whole family, you just all stay low until your fever's gone, okay? However, if you have those same symptoms and you have diabetes, you have lung disease, anything like that, I do want you to touch base with your doctor, because that could make you more at risk for this progressing, or maybe it could make your underlying health condition exacerbated. You need some guidance for that. So underlying health problem, call your doctor. Be patient. They're getting a lot of calls, as you can understand. Be patient. Call your doctor. If, on the other hand, you were feeling great, now you've got a fever and you've got a cough and you're having a little difficulty breathing, or you're having chest pain, or both, I'd like you to go to the ER. It may be COVID. It may be influenza. We're still having a lot of that. It could be pneumonia. You need to go to the ER, though, if you're having chest pain or shortness of breath, because that means you're sicker and things could progress more quickly. Does that help?
It does help. Let me back up a second. So I've got that family situation where I have the cough and the fever, but yet my family members don't yet. Should they be out in public? Should we all stay home for that 2-week period? Are we at that point?
I would like everyone to minimize the time that they're out and about. So yes, especially if you have a family, because we know with flu that these things circulate in families. If you have it today, your family's going to probably 1 or 2 members will have it by the end of the weekend. So yeah, I would like people to stay home. But I also say I want you to be disinfecting things in the house. That will, if you have one person sick, they can get their iPad or their iPhone and go in the bedroom and stay in there. You bring stuff in a disposable, paper plates and cups and stuff like that. Wash doorknob. The big thing to wash are doorknobs, keypads, those kinds of things where people have a lot of contact. And you can minimize the spread in your house. Come Monday morning, if you're not sick, go to work, go to school. You can do that. If you have a fever is when I want you to stay home. But if you have a family member, yeah, I think it's kind of isolate them in the house, and everybody, just because you may have had the same exposure they had, right? You may have been at the same person, and you're just now showing symptoms 2 days later. So I think we can all take a day or two and just hang out and see what happens. Monitor our temperature, because you may have had the same exposure.
If I'm feeling healthy, are you suggesting that we not go to restaurants and movies and that kind of thing at this point?
Well, I'm suggesting that during the next week or so that you limit that kind of thing. But I don't know about you, but I do everything online. I'm probably well known at more restaurants than I care to have people know, because I just go pick. I don't use Waiter on the way in that yet. I'm not that sophisticated, but just order it in and go pick it up. They usually bring it out to your car and go home and have a nice day. I'm not saying don't utilize services. I'm thinking, again, think differently. Yeah, every Saturday night you might go out to eat. We'll call in and order it and get it to go. Okay. Especially, though, I think who really needs to kind of heed this advice now are the people 50 and older who have an underlying health condition. You are the population that's having the worst clinical course with this disease. Not saying you would, but you are the target population. So keep that in mind as this becomes introduced into our community. It's here already. We just haven't had any positive cases, but we have so much international travel. We've probably had it here circulating just like other communities for the last month. We just don't have any testing to show that it's here. So keep that in mind. Am I at risk? If I get this virus, what's going to happen to me? What could happen to me? And then, we're all grown people. You're going to make good decisions. We want to keep our restaurants going. We want to keep things going, but we don't want to sacrifice the health and well-being of our community and our hospital and healthcare infrastructure by those kinds of actions.
Yeah, we heard yesterday that there will be additional drive-through testing at CVS, Target, some other locations. Will those people coordinate through you? Do we know yet when, if any at all, of that is coming here?
Certainly corporate won't, but I can tell you that our local pharmacies have been working with us, so I'm sure they will work with us and let us know, but of course they're dictated by their corporate folks. But we have been working very collaboratively with I don't want to name one because they've all been working very collaboratively in terms of how to make the resources people might need more readily accessible within the stores, some guidelines, things like that. So I'm sure they'll let us know, but that's all going to be dictated at the corporate level, so I certainly haven't been made aware of anything like that. That reminds me, though, testing is only helpful if there is a reasonable risk that you have the disease. Otherwise, for something that will be here for 6 months, if you don't have any symptoms, you just want to know if you've been exposed, you could be early on and get a false negative. Right? So, and then you're thinking, oh, good, I'm safe. I don't, oh, that cough, oh, it's probably just something else. Testing is only, and we're in America, we're used for a test for everything, but testing really is only helpful when it's truly indicated. So don't think if you get tested once, well, I'm done for the rest of the next 6 months. It makes no sense.
Yeah, it's a snapshot. It's at this moment in time. Deb, I've got to let you go. Thank you so much for your time this morning. I sure appreciate it. All the work that you've been doing, it's really meaningful.
Well, Lee, you've been asking some really great questions that really help get some things that I haven't thought out to the public. I just want people to know our number one goal is to keep healthcare up and running. Do what you can to keep that going.
And you let me know if there's anything we can do to help.
All right. I sure don't say that if you don't mean it.
Thank you very much. That's LA County Health Commissioner Deborah McMahan, and we are going to roll on with the second half of the HealthCall Live Radio Hour in just a moment.